We previously had a study on clonal hematopoiesis and multiple myeloma, and back then we focused on patients who got an autologous stem cell transplant, and we saw that clonal hematopoiesis is associated with a worse progression-free survival and worse overall survival. So this time we were interested in looking at a larger cohort from multi-center cohort, and that included patients who were not transplanted as well. So we used the Multiple Myeloma Research Foundation cohort who had both tumor and peripheral blood samples, whole-exome sequencing data on both of these samples, and we were able to really call the true clonal hematopoiesis mutations from their samples and take out all the contaminating tumor mutations. And basically we saw very similar findings, which was good because it confirmed our previous findings. And in particular, we looked at those who did not get a transplant, and we still saw that clonal hematopoiesis was associated with a shorter progression-free survival. And more interestingly, the Multiple Myeloma Research Foundation cohort had sequential samples, so they got peripheral blood samples over time while they were getting treatment, and we noticed that if we're following those samples and looking at the mutations, we actually see that there is a rise in the prevalence of clonal hematopoiesis over time while you're getting treatment. And we looked at around 50 patients who had a baseline sample and then sequential samples, and the prevalence or the incidence of clonal hematopoiesis went up from around 6% to 25%, and that's over a median of 3 years, which is a very short period of time. So basically, while this doesn't tell us yet the long-term implications of what clonal hematopoiesis is going to do, but it's worth to investigate further to see how treatment is really affecting clonal hematopoiesis and what are the consequences on the long run.